Hello everyone, my name's Jay. I'm one of the expert OET teachers here at E2Language. In this live class, we're going to look at Listening Part B. What you'll find is that Listening Part B is kind of a mirror of Reading Part B. So if you're familiar with the method for Reading Part B, it's a pretty similar method we apply to Listening Part B because these two question types are almost exactly the same. One you read, one you listen to, however. So what we're going to do in this live class more specifically is I'm going to describe this subtest to you. I'm going to show you what it looks like and what it sounds like. We're going to try one and we're going to look at the transcript, which will help us to understand how these questions work. I'm going to then show you a method which will make it much easier. We're going to do 5 practice questions and then I'll show you the answers at the end, okay? Just before I continue on, I just want to acknowledge that the sample test we're going to use is an official sample test from the OET website, and E2Language has been given permission to use this to make this video, so thank you OET for that. So what you're about to see is real high quality, actual practice, good quality practice, okay? All right, let me describe listening subtest part B2, and the way that I will do this is I'm going to play the audio just like you would hear in the exam. So on exam day, you're going to hear this.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen.
So in short, you're going to get 6 questions. Each audio will be different, discrete from the others. It'll be a monologue, one person speaking or 2 people speaking. They go for about a minute and a half each. And there'll be a multiple choice question with 3 answer options, okay? Pretty straightforward. Let me show you what it looks like on the paper. So you can see here number 25. First thing you see, and also what you will hear, because this will be read out by the speaker, is the context sentence, which is very important because each context will be different. This one says you hear an optometrist talking to a patient who's trying contact lenses for the first time. Okay, so you get an idea of who's going to speak and where they are and what the profession is. Next thing you see is the question prompt. This one here that you're looking at is a direct question. It has a question mark on the end. It says, what is the patient concerned about? So they're usually quite brief and succinct and direct. However, you can get question prompts that are incomplete sentences. They're not direct questions. And with this one, what you have to do is match which sentence fits best, okay? Which other half of the sentence fits best. And you'll get 3 answer options. I should say all of these answer options will be mentioned in the audio, okay? So if you just hear something about blurred vision, it doesn't necessarily mean it'll be correct because maybe the patient will say something about that. Anyway, let me describe that to you in more detail because ultimately this is what it's testing you for. It's testing your ability to be able to listen for a specific thing, to listen for something like a patient's concern, okay? Let's look at and read what I mean by that. Okay, so there's the question again. You hear an optometrist talking to a patient who's trying contact lenses for the first time. What is the patient concerned about? His blurred vision. Sorry, this should say his. Soreness in his eyes, or how to remove the lenses. What I want you to notice with this is that each of those answer options are actually mentioned. Let's have a look at the green one first. Soreness in his eyes. Not bad. I thought I'd feel them, the contact lenses, actually touching my eyes, that they'd be sore or prickly. Soreness. But I can't feel much at all. Let's have a look at the purple one. Is he concerned about how to remove the lenses? I had no trouble taking them out earlier, but I'm not confident about putting them in. I worry I'll press too hard. Is he concerned about his blurred vision? Things look rather distorted though. I mean, I can't make out the letters on the chart. The point of why I wanted to show you that is just because you hear something doesn't mean it will be right. Each of those answer options is in fact mentioned. The soreness, the blurriness, and how to remove the lenses. You need to listen deeper, more deeply to what actually is the concern, okay? So let's do this one, and then you'll get to hear what it sounds like as well. Away you go.
Now look at question 25. You hear an optometrist talking to a patient who's trying contact lenses for the first time. Now read the question.
Now, you've had the lenses in for a few minutes. How are they feeling?
Not bad. I thought I'd feel them actually touching my eyes, that they'd be sore or prickly, but I can't feel much at all. My eyes do feel a bit watery, though.
It's okay. You've just used too much solution. Now, in a few minutes, I'll get you to try taking them out and inserting them again by yourself.
I had no trouble taking them out earlier, but I'm not confident about putting them in. I worry I'll press too hard.
That's unlikely to happen.
Things look rather distorted, though. I mean, I can't make out the letters on that chart.
Any of them?
Those lower down.
Let's give things another minute to settle down.
Okie dokie. How did you go? Which one did you choose? Now, I made this way easier for you because we saw the transcript and we read the transcript. So you can imagine on test day, you have no idea what you're going to hear. I mean, there's a context sentence, then it starts speaking, and it's rapid, so it's going to be much harder. Nevertheless, that was good practice, and I'm glad you've done one. So the answer, of course, was A, his blurred vision. What is the patient concerned about? Well, the patient says, things look rather distorted though. I mean, I can't make out the letters on that chart. So what's going on here? We'll have a look at these synonyms. Blurred, distorted, right? And then this phrasal verb here, make out. I can't make out the letters. I can't see the letters on that chart. So it's all about, he's concerned about his blurred vision, right? Hopefully you got A because that was pretty straightforward. But what I want to teach you is a method. There's a way to approach these questions to make it much simpler and a lot less frightening. The fear comes, I think, from having all this text in front of you and having this audio that's about to start. And one thing that the human brain cannot do is read and listen at the same time. You cannot read and listen at the same time because it's utilizing the same part of the brain. So if you're reading, you're not listening. And if you're listening, you're not reading. Now, this is a listening test, so which one of those do you think is better to do? Reading or listening? Of course, the answer is listening. It's a listening test. So I want to teach you how to approach these questions. First of all, as you heard, the audio will actually say the context sentence. It's important to listen to this carefully. You don't need to memorize it. You just need to listen to it to get an idea of where the speaking is taking place. You hear an optometrist talking to a patient who's trying contact lenses for the first time. Cool. More importantly, try to determine who will speak. You're going to hear an optometrist and a patient, okay? Because they're going to take it in turns. Now, the tricky thing about this, sometimes it will be you'll hear an optometrist talking to a GP about a patient. So who's doing the speaking there? It's the optometrist and the GP, but they're talking about a patient. So just be careful with that one. Remember, the two people max will be speaking. Okay, this is critical, this question prompt. If you miss this, you cannot get the answer. This is what it's all about. You need to burn this question into your mind, okay? You get time to read the question. It says you now have time to read the question. You need to fundamentally know what you're listening for, okay? And what you can do is you can transform it from a long question, like what is the patient concerned about, to make it easier on your memory. You might want to simplify the question to aid your memory. Just think patient's concern, patient's concern. What's he concerned about or what's she concerned about? Okay, that keyword concern. Then this is also critical because this is what I mean by you can't read and listen at the same time. You should ignore the answer options until the audio is over. You need to trust yourself. You can even put your hand over it and you just concentrate purely on listening. Because if you're reading those answer options and listening at the same time, well, as you're reading, you're not listening. And if you miss, you saw how quick that went with that blurry vision. It was like 3 or 4 seconds, boom, gone. You might have missed it. So what we're going to do is practice this. I want you to practice it. I want you to trust me and I want you to trust yourself because you're a good listener and it's better if you just concentrate 100% on listening. As long as you have that question prompt in your mind, what is the patient's concern? Patient's concern, you're listening for something, okay? So again, this is what you are listening for. Now, just to make it a little bit more complicated, remember I said there were incomplete sentences? This kind of makes it hard to refine. This one says, let's read the context sentence. It says, you hear 2 radiologists talking about the type of scan to be given to a patient. They agree to choose the method which will. What you need to try to do is, in the reading of the question time, turn this sentence into a question for yourself. Try to read this and turn this into a question of what you would listen for. Okay, for example, which method do they choose? Method, which method, which method, which method? So you would look at this, they agree to choose the method which will, forget the answer options, which method do they choose? Okay, all right, cool, I've given you enough methodology practice there. Let's put it into practice. On a piece of paper, I want you to write down 26, 27, 28, 29, and 30. We're gonna do 5 because we've already done 1. And what I want you to do before we do that is I want you to subscribe to this YouTube channel. The reason is, every time we create a new video and upload it or do a live stream, you'll be notified and it'll be a little ding on your phone. You can watch it live, be the first people to know about it. And if you're enjoying this, click thumbs up and leave a comment. You can leave your score at the end. That would be very interesting. So put your score in at the end perhaps. Okay, here we go. 26.
Question 26. You hear a nurse asking a colleague for help with a patient. Now read the question.
Kathy, could you help me with the patient in bed 103? The woman who had surgery 2 days ago.
Oh, yes, she's due for discharge today, isn't she? Does her pain relief need topping up again? I thought she wasn't very comfortable this morning.
Oh, she's on a reasonably low dose, but she's coping. She needs her chest drains removing, though, and she's got herself into a bit of a state.
Ah, well, that's a 2-person job anyway, so I'll come with you. Has the consultant seen her? I know there was some concern yesterday about her condition and the level of the fluids draining into the bags.
Oh, he's cleared her for removal of them today, but I think some reassurance might be needed first.
Right. I might just check her analgesia and give her more before we go ahead.
Okay.
How did you go? Hopefully you trusted that method. Hopefully you burned that question into your mind. Why does the nurse need help? Why does the nurse need help? Why? And you're listening for that. Hopefully you didn't read the answer options as you were listening because as I said, you can't do both at the same time. And if you're reading, you're not listening, you might miss it. Hopefully you got the right answer. We'll come to that in the end. Let's do another one.
Question 27. You hear a senior nurse talking about a new initiative that has been introduced on her ward. Now read the question.
One of our key priorities is improving communications between staff, patients and patients' families. We recently introduced a scheme called Dear Doctor, which involves giving each patient a card where they can make a note of any questions or concerns that they themselves have. They can also talk to their families during visiting time, or even on the phone, and see if there's anything else they'd like to add. The cards are then collected and given to the doctor before the ward round. We're really pleased with the response. Patients used to say that they only thought of the things they felt they needed to discuss when it was too late, so the cards give them a better chance to bring up whatever's on their minds. In fact, it's been so successful that we're going to roll it out on all wards in the hospital.
Question 28. You hear two radiologists talking about the type of scan to be given to a patient. Now read the question.
I've just had a phone call from emergency. They have an 11-year-old boy with right lower quadrant abdominal pain. They're concerned about appendicitis, and they'd like to order an abdominal CT for him.
Do you think that's a good idea?
I was thinking maybe we should recommend an abdominal ultrasound, because then we can spare him the radiation.
Is there any concern in this case around using ultrasound instead of CT? Accuracy, for example.
The sensitivity is slightly less than the CT, but the specificity is almost the same, so I think we can rely on the results.
Okay. It means we can avoid the child being subject to contrast exposure as well. But what would we do if the ultrasound doesn't answer the question?
If we can't visualise the complete appendix, then we can recommend an abdominal CT.
Okay, we have a plan. Call them back and let them know.
Question 29. You hear part of a surgical team's briefing. Now read the question.
OK, next is Mr. Malloy's repeat laparotomy. Any anaesthesia issues?
We don't expect any particular problems. He's relatively fit and well, except for his epilepsy, which is under good control. His BMI is 35.
But will we need the obesity bed?
It shouldn't be an issue.
And what about the epilepsy post-operative management?
He's taking his oral medications, and we can use an IV if necessary.
I know he was in a lot of discomfort after his last surgery, and this time he's going to need a larger midline incision. It may be worth thinking about an epidural. He's certainly at the extremely low edge in terms of pain threshold.
Question 30. You hear a senior research associate talking about a proposal to introduce interprofessional primary healthcare teams. Now read the question.
We're looking at opportunities to improve the effectiveness of health and healthcare systems here in Canada. One of the interventions we're looking at is interprofessional primary care teams, groups of professionals working together collaboratively to provide services including healthcare, social services, and advice to patients within the primary care setting. There's evidence that teams like these can improve chronic disease outcomes, including diabetes, hypertension, and heart disease, as well as mental health problems. There's also evidence that improvements can be made in terms of both access to and coordination of care. Now, the extent to which these teams could affect the costs of healthcare in such areas isn't quite clear within the evidence, but the work we're doing aims to address such issues while looking at the challenges of implementation and evaluation.
All right. How did you go with those ones? They're pretty tricky, right? I think the trickiest thing is not the listening. The listening's pretty straightforward. They're having a regular conversation and it's very clear. It's not too rapid. The tricky thing is coordinating all of that written text with the listening at the same time. So again, I can't stress how important it is to make sure you listen. That is the emphasis. That's what this test is all about. Now, you may have heard some background noise because my office is a little bit noisy, but that's probably good practice too, because in the exam center, people will be sniffing and coughing and doing all sorts of stuff. So it's probably good practice. All right, let's have a look at the answers. So you hear a nurse asking a colleague for help with a patient. Why does the nurse need help? Well, the patient's worried about a procedure, okay? Now, the deterioration of the condition, the increase in pain levels were probably mentioned, but the answer is B. 27. You hear a senior nurse talking about a new initiative that has been introduced on her ward. What problem was it intended to solve? Now, the tricky thing about this question prompt is it referred back to the new initiative. So what problem was the new initiative intended to solve? That was hard to keep in your mind, and the answer is C, patients not discussing all their concerns when meeting the doctor. 28, you hear two radiologists talking about the type of scan to be given to a patient. They agree to choose the method which will, or in other words, which method do they choose? The one that will have the fewest risks for the patient. C. 29, you hear part of a surgical team's briefing. The male surgeon suggests that the patient could, or in other words, what does the male surgeon suggest the patient could do? B, benefit from a specific anesthetic procedure. Whoopsie, this must be number 30, my apologies. You hear a senior research associate talking about a proposal to introduce interprofessional primary healthcare teams. What hasn't been established about the teams yet? What hasn't been established? What hasn't been established? B, the financial impact that they are likely to have. Cool. As I said, please put how many you got right into the chat below, into the comments below. I'll be very interested to know. Leave a comment if you like what you're seeing and a thumbs up, and also click that subscribe button. That'd be great. Now, if you had trouble with that, or if you're worried about any other parts of the OET, including writing or speaking, remember speaking has an updated criteria. It's not as easy as it used to be, that you are assessed on different elements now. If you need more practice, if you need some expert professional help, then you should check out www.E2Language.com. You can sign up for free to our OET preparation course, and if you like what you see, you can upgrade your package for one-on-one tutorials, writing feedback, access to the live group classes, as well as lots of test practice and skill building stuff and much more. Remember that E2Language is a premium preparation provider, so we're one of the few in the world who have done the rigorous OET training to make sure our materials are up to scratch. We've got writing practice for doctors and nurses and speaking practice for doctors and nurses, by the way, so yes, cool. Anyway, hope that was helpful. Hope you enjoyed it. Hope you found it insightful, and good luck.